They found him alone, slumped forward in his recliner. No wounds, no cry for help, just silence. The TV still flickered, his robe hung loosely, and in the room, an eerie stillness. The kind of quiet that only comes after something irreversible. The autopsy said natural causes, but for those of us who know the signs, it was something else. A silent hormonal collapse, not from illness, not from trauma, but from neglect, the slow unraveling of a man's vitality. And tragically, he's not the only one. Every year, thousands of older men follow the same path. Strength fades, desire disappears, emotional clarity dulls, all while they think they're doing the right thing, by giving up something they were told they no longer need. For decades, men have been told to avoid self-pleasure, that it's childish, shameful, unnecessary. But here's the truth no one wants to say out loud. After age 60, that belief can quietly cost you everything. When older men stop masturbating, their bodies don't just pause. They begin to break down. The prostate stagnates, testosterone levels crash, emotional resilience withers, and by the time the effects are noticeable, it's often too late. I'm Dr. Mohit Khera, board-certified urologist and men's health specialist. For over 40 years, I've helped aging men reclaim their vitality, their confidence, and their independence. From farmers to veterans, grandfathers to teachers. I've seen the same pattern. Men who thought abstaining was virtuous, only to learn it quietly sabotaged their health. The habits they formed decades ago, the ones society shamed them for, are now backfiring when they need their bodies the most. But there's good news. In this video, I'll show you the 4 critical health consequences that happen when you stop masturbating in older age. And more importantly, how to prevent them. These aren't gimmicks. They're simple, practical, medically backed strategies used by thousands of my patients to preserve their sexual health, restore energy, and avoid problems that many men assume are just part of aging. And make sure you stay to the end, because the final consequence I'll share is rarely discussed, even by doctors. Yet it could silently triple your risk of prostate complications if ignored. If you care about protecting your body, your confidence, and your independence, you'll want to hear it. If you're with me, type 1 in the comments. If you're skeptical, type 0. Both are welcome, because older men deserve this conversation without shame and with real answers. Now let's begin with the first and perhaps most dangerously overlooked consequence of giving up masturbation in old age. I've seen it more times than I can count. A man in his late 60s or 70s walks into my office. He's confused, frustrated. He tells me he hasn't had a spontaneous erection in months. Sometimes it's been over a year. What shakes him most isn't just the performance, it's the suddenness. One day he felt like himself. The next, something simply stopped. Most men never expect it. No one warned them that giving up sexual activity could cause their sexual function to quietly fade, like an unused muscle. Let me put it plainly, your penis is not just an ornament. It's a functional organ, and like your legs or your heart, it requires regular circulation to stay healthy. Go long periods without stimulation, especially past 60, and here's what happens. Blood flow slows, oxygen delivery drops, tissue starts to stiffen, not in a good way, but in a way that leads to fibrosis, nerve damage, and permanent loss of erectile function. That's not a theory, that's vascular biology. It's like staying in bed for 6 months and expecting your legs to work perfectly after. They won't. The same principle applies to your sexual function. It doesn't go on standby, it starts shutting down. And it's silent. No warning lights, just one morning the usual signals are gone. No spontaneous erections. No response to touch or fantasy. Eventually, not even medication helps. Because the foundation is already eroded. I've had men break down in my office, asking if it's reversible. Some regain function with aggressive therapy, medical intervention, and time. But others? They waited too long. They thought stopping was harmless, a sign of willpower. But in truth, it was the first step in functional decay. This isn't about being obsessed with sex. It's about preserving a vital part of your circulatory and hormonal systems. And yes, your sense of masculinity. Even occasional solo activity, just once or twice a week. can keep blood flowing, nerves firing, and your body aware that this function still matters, because what you don't use, you start to lose. And at an older age, that loss can become permanent. I've seen it devastate men, not because they're trying to impress someone, but because it touches their confidence, their relationships, their self-worth. And the tragedy, it was preventable. All it took was consistency. Not indulgence, just attention. Now here's the part most men never see coming. The loss of erections, that's just the beginning. The second consequence is even deeper. It impacts your hormones. Testosterone doesn't just decline naturally, it crashes faster when sexual stimulation disappears. It starts subtly. You stop feeling like yourself. You're not excited in the morning. You skip your walk. Your appetite dulls. You're more irritable. You feel more tired, more withdrawn, and deep down something feels off. Many blame stress, sleep, or just getting old. But often the root cause is hormonal collapse. And here's what they're not telling you. Masturbation is one of the only non-pharmaceutical ways to stimulate testosterone production in older men. It's not about fantasy, it's about neurobiology. Regular arousal sends signals to the brain, boosts dopamine, and supports your hormonal rhythm. When your hypothalamus is stimulated, yes, even in your 60s or 70s, it sends a clear message to your testicles. Keep producing testosterone. But when sexual activity stops altogether for weeks or even months, the signal your body receives shifts dramatically. It assumes intimacy is no longer needed and begins to reduce hormone production. And once that process starts, it becomes incredibly difficult to reverse. Low testosterone doesn't just make you feel tired, it chips away at your very sense of self. You start losing focus. The drive and passions that once defined you begin to fade. Your muscles weaken, your bones grow more fragile. Depression becomes more likely, and perhaps most dangerously, your risk of cardiovascular disease skyrockets, putting you at greater risk of heart attacks and strokes. I've seen men, once full of life, slowly become shadows of themselves, not because they were ill, but because no one ever told them how essential regular, healthy sexual stimulation is for hormonal balance. One of my patients, a retired firefighter, described it perfectly. After his testosterone levels dropped, he said, "Doc, I don't even recognize the man in the mirror." That wasn't vanity talking, it was grief. And the tragedy? It didn't have to happen. With the right knowledge and a simple, natural habit, one he'd been taught to feel shame about, he could have preserved more than just his hormones. He could have protected his confidence, his vitality, his energy. Because here's the truth. Once testosterone crashes in old age, bringing it back can require years of treatment and tens of thousands of dollars, if it returns at all. But with steady, respectful engagement in your own sexual health, you can maintain your hormonal balance far longer than most people believe. And while low hormones can go unnoticed, their consequences often manifest in painful physical ways. Ways many older men don't talk about until it's too late. Let me explain. There's a type of discomfort that creeps in quietly, a dull, heavy ache deep in the pelvis, pressure after sitting, or the need to urinate even when the bladder isn't full. It doesn't come on like a heart attack. It builds slowly, silently, until it begins to disrupt daily life. By the time most men bring it up with their doctor, they've been living with it for months, sometimes years. And often the cause is something surprisingly simple: prostate congestion caused by a lack of ejaculation. Your prostate isn't just sitting there, it's an active gland that produces and stores seminal fluid. That fluid is designed to move. When ejaculation stops, whether through lack of sex or masturbation, the fluid thickens, pressure builds, and inflammation sets in. That's when symptoms start to show up. Weaker urine flow, lower back discomfort, that frustrating need to pee in the middle of the night. And as a urologist, I see it all the time. Older men come in thinking they have a bladder problem, when in reality, their prostate is congested, inflamed, and irritated. And the fix? In many cases, it's not medication. It's movement. It's the body's natural cleansing process through regular ejaculation. Ignore this long enough, and the consequences escalate. Some men develop chronic prostatitis, an ongoing painful inflammation that's notoriously difficult to treat. Others end up needing invasive procedures just to find relief. But beyond discomfort, there's a more serious hidden danger: cancer. Multiple studies, including one from Harvard, have shown that regular ejaculation may lower the risk of prostate cancer. The logic is simple. When the prostate is regularly emptied, it reduces the accumulation of potentially harmful substances. Let those fluids stagnate for months or years, and inflammation and long-term cancer risk can rise significantly. One patient of mine hadn't had any sexual activity in nearly 2 years. He said he didn't feel the need anymore, thought that part of life was behind him. But when his PSA levels spiked and we ran more tests, we found a severely congested, swollen prostate. He was facing a biopsy, something that may have been avoidable with just occasional natural release. This isn't about lust, it's not about indulgence, it's about prevention. About understanding that just because you've reached a certain age doesn't mean your body no longer needs care. If anything, it needs more. The prostate is one of the most vulnerable organs in older men. And when it's neglected, the damage isn't just uncomfortable, it can be life-changing. The final consequence hits deeper than most men expect. It doesn't show up on blood tests. You can't measure it easily, but you feel it, quietly, steadily, as it begins to take hold. Let me show you what I mean. It's the slowest, quietest decline, and often the most devastating. It starts with something simple. You stop masturbating. Maybe it feels unnecessary. Maybe it's because you're not in a relationship. Maybe you think it's just part of getting older. But over time, that choice doesn't just affect your body. It starts to touch everything. Your mind, your mood, your very sense of being alive. I've spoken with men who've described feeling hollow, not from illness, not from pain, but from going months, even years, without any form of intimacy, even with themselves. Slowly, they begin to feel invisible, unwanted, unnecessary, and they don't talk about it, because they were never taught how. But it shows, in their walk, in how they avoid mirrors, in the way their voice is lower when you ask how they're really doing. This isn't about sex, it's about vitality. About staying connected to the part of yourself that still feels, still longs, still wants to be fully alive. Because when you give up self-pleasure entirely, you don't just give up arousal, you give up one of the last natural pathways to joy, self-recognition, and emotional health. And for men over 60, that's not just a loss, it's a wound. Pleasure, arousal, and release aren't just for the young. They are neurologically tied to your mental and emotional well-being. Dopamine, oxytocin, endorphins, these chemicals aren't luxuries. They're essentials. They reduce anxiety, regulate mood, stabilize your emotional state. Without them, you're more likely to feel down, lonely, disconnected. Even your cognitive function can begin to fade. I've seen men who used to be confident and outgoing slowly become quiet, withdrawn and numb, not because something traumatic happened, but because they disconnected from a part of themselves that once gave them life. And what makes this decline so dangerous is that most men never realize what's happening. They don't connect the emotional emptiness to the decision they made months ago, to stop engaging in intimacy. By the time the symptoms show up, the damage has begun. And fixing it takes more than a pill or a new routine. It takes rebuilding the relationship with yourself. It takes remembering that your body, even now, still longs to feel, to express, to connect. This is the consequence that breaks my heart most, because it's the one that takes away a man's dignity without him even knowing. It steals his quiet confidence, dulls the warmth he used to share, and leaves behind a version of himself he barely recognizes. But here's the truth I want every man to hear. It's not too late. It's never too late to come back to yourself, to reawaken the spark you thought was gone. And in the final part of this message, I'll show you how, with simple, science-backed steps you can take today to protect what so many men have lost, and what you still have time to reclaim. Let's finish this together. There's a belief many older men carry, that intimacy, desire, and pleasure are things you grow out of, that after a certain age, your body is supposed to go quiet, that it's somehow noble to give that part of yourself up. But after more than 30 years working with men in their 60s, 70s, and beyond, I can tell you that belief is costing men their health, their happiness, and their identity. You've heard what happens when you abandon this part of yourself. Your sexual function slowly declines. Testosterone crashes, your prostate becomes swollen, inflamed, and emotionally, you begin to go numb. These aren't small side effects, they're life-altering changes. And they don't happen because you got old. They happen because you stopped paying attention. But it doesn't have to be this way. Your body still remembers how to feel. Your mind still craves connection. And your health still depends on how you treat every part of yourself, even the ones no one sees. This isn't about lust. It's about life. It's about preserving what makes you feel strong, whole, and human. You don't have to feel ashamed for choosing vitality over silence. If this message resonated with you, even just a little, type 1 in the comments. Let me know you're still here, that you still care, that you're still fighting for your health. And if it didn't, that's okay too. Type 0 and tell me what you need. Either way, your voice matters, and you're not alone. You're not done yet.